So blood comes back from your body.
But if there was a vein right here, it'd be the external or internal jugular.
One of two locations.
So
Number
we cut
one,
brachial,
superior vena cava,
but it would follow
and
a
your
similar pathway.
inferior
You
vena
have,
cava, which is
subclavian, and then it'd be axillary.
right here.
And then
Let me
this
just
part's
try to stick this in there.
I don't know who did that. And then this here is our subscapular.
So inferior, or no, superior vena cava is right here. Inferior vena cava is over here. It comes through the heart,
So aorta here,
the right atrium,
right here, where it
and
starts
in the right
branching.
atrium, before it goes to the right ventricle, is the tricuspid valve right here.
I know you need innominate vein, I don't know if you
This valve, it's like right here. You see that? Okay.
Okay, that branches into
Holding the valve, I guess, together,
so
these
right common carotid, left common
string-like
carotid.
things right here.
Follow the common carotid.
That's the chordae tendineae, and holding,
And the
or I guess
first branch
attached,
towards the mouth.
or holding the chordae tendineae together, it's attached right here at the base, is your papillary muscle.
Keep following it up.
You can kind of see it's like elevated.
Is the external.
The trabeculae carneae on here
And then you're missing them, but
are like
first
this
branch
holy
in this direction
web-like
would be the
substance right
occipital
here.
artery, and then the second branch would be the
It's like-
internal carotid.
I don't really know how to describe the texture of it, but it's right down here.
Oh,
Spongy, that's what it is. Okay,
kind of
nice.
nub right here.
Um,
It's actually a vein that dives down.
And then blood
and
leaves,
it's the vertebral
goes
vein.
to the
So it's
lungs
going
via
down towards the vertebrae.
pulmonary artery, which is this guy right here.
Nub
Okay.
And if
inside
you are
of
going to
it
get the valve,
Right
valve
there.
is right here.
is the costa cervical.
This little flap.
And then
Oh,
coming off
okay.
the heart,
The
in this
semilunar.
direction is your left subclavian
Yeah, I'll give you this one.
artery. And the first branch of that,
That
right
was the
here,
shitty one.
is vertebral.
Yeah, so this is the pulmonary
Internal
semilunar
memory,
valve right here.
Artery.
Pulmonary
internal
artery.
So anything that's
Oh,
projecting
forgot
up
to
is
mention.
internal.
The heart has two auricles right here. They look like ears. So here is the right auricle. You can kind of tell it looks like an ear. That's where we cut in. And this right here is the left auricle. If you don't know which side it is, the heart will most likely be opened up. See, that wall is very thin. Thin wall is the right side. Open up this side. Look how thick that side is. Thick walls is the left side. So when the blood goes to the lungs, it comes back in either, I think it's one of six pulmonary, or comes through all six pulmonary veins. So here's one of them. I believe this is number 2.
Okay.
And the other 4
I should've
are
done
probably
routine
gone.
stuff, right?
But just know there are more. There's more than one pulmonary vein coming
Internal
to the
pulmonary vein.
left side of the heart. You have the bicuspid valve.
So again, if it's sticking up in the
Then
air,
again,
it's
you
internal
have
memory.
the
Those are
chordae tendineae,
Okay. On this side,
papillary muscles where it's
we have
attached
the
to it.
hepatic portal vein, right?
And
there.
then even deeper, you can see it's even
So
better
if
down
he
here.
has the guts
Yeah.
to this
Trabeculae
side,
carneae,
it's
that's a
hepatic.
better.
And it's like there's no
representation.
vessel around it, so that one's easy.
Then the blood leaves via the aorta,
Let's flip the guts back over.
which is
Okay,
much easier to
we're
see
down
here,
Here's our aorta, descending.
just like that.
And this bad boy is.
And if you're gonna get the
inferior
aortic
cava.
semilunar valve, it's
branching, the
this
first branch
flap
off the aorta
right
in the
here.
lower body is the celiac. And the first branch off the celiac right here.
and lastly,
is the hepatic artery.
You have
Second
the
branch off of the celiac.
arches of the aorta. So the first one, if you're looking at it from the front,
And as soon as you reach the left gastric
first arch
artery,
right here is the
the
innominate,
celiac becomes.
and the one right next to it is
So
the
this is
left
the spleen.
subclavian. Make sure you
So
put
as soon as you
left,
hit the
because
left
if you just put
gastric,
subclavian, it'll be wrong.
Celiac becomes the spleen.
Innominate, left subclavian.
Right
Human
below
is
splenic
brachiocephalic,
artery, this thing is our gastrosplenic
left
vein.
common carotid, and left
He won't
subclavian
show
artery.
it to you on cabinet as it died. But
Could
the
you
vein-
show, like,
any
the
vein
orientation of the
following
front versus
along
the back?
splenic is
Like
the
how?
splenic vein.
Because it's like shaped differently.
See, it goes
This is
all
the
way
front,
out
and the way
here.
you tell is the interventricular septum, which
Okay.
is this
Second
thing
branch
right
up
here.
to the aorta. Superior mesenteric artery.
Yeah. I always look for like
Ten branches.
2 lines. Oh, this cut wasn't there. You'd be able to see there's like a white line there, and there's a white line there, and that's how you know that this
And it's connected to the colon.
connects the ventricles. This is where we cut it.
This is our adrenolumbar vein.
Yeah, so if you,
Adrenolumbar
ever
artery
can't
didn't
tell, look
inject,
here.
but I'm pretty sure this is
or if you never know what side of the heart it is,
I
just
know
look at the
there's
wall
arteries
size.
that curve that.
It's
This
pretty
is your
obvious.
renal vein. again, the renal
Other than
artery.
that, did I miss anything?
Oh,
I don't think so.
Okay, you won't be able to touch it though, right?
Thank
No,
you.
it'll
Yeah,
it'll
we'll
be
able to
like
touch it.
Like, will the wall size be?
Like, will they always be
yeah,
open?
he'll
Right there.
open it and he'll just pin the walls down or the flaps open so you can tell what
but
it's going.
anything
Yeah.
attached to the kidney,
Okay.
The wall size should be pretty obvious. I mean, I think
This
it's
is a
pretty
female
obvious right
cat.
now, but
So here's the ovary.
other than that, there's really no
Connected to
tricks.
The ovary, you have ovarian artery.
Maybe just the
ovarian
vessels. I
vein.
mean, if you were to
If
give
it was a
you
male, you'd have vessels coming off
a
of similar
pin and
places,
just did
they
this.
dive straight down, and they'd be the internal spermatics.
if you just gave you a pin, I guess that would be confusing. But I feel like you'd have
Down
to give you
here
something
we
to
have
reference to.
ileal
Yeah, they could
lumbar
go
artery.
through it.
Yeah, so he'd probably, if anything, cut something open
And then
stick it
the last
through, and
branch
you
off
know,
the artery
okay,
we
you
have
look at
to
the
worry
wall,
about
that's the
is
right
the
side,
inferior
so it
muscle
has to be one of the vena
which
cava,
branches upwards
depending
into
which one it is.
Depending, yeah.
and branches
Other than that, if
downwards
you know,
into the superior
look at the left
hemorrhoidal.
wall, the only vessel that comes into the left side is
colic
a
up,
pulmonary vein,
superior hemorrhoidal
and it has to leave the aorta.
And then the aorta branches
That's about it.
as you
Pulmonary
get down
artery
further into the external
leaves the
iliac
right, or
arteries.
left and right ventricle goes to the pulmonary artery, so.
Femoral arteries.
any
Then you
questions?
exit the body wall. So this is all
good.
femoral.
Thank you.